This is The Roadmap with Lee Heisman.
Hello, everyone, and welcome to The Roadmap, exclusively here on ASBN.com. I'm Lee Heisman, and every week we bring you some of the brightest entrepreneurs, CEOs, and business owners who are climbing the ladder, scaling their businesses, and thinking one day how to exit stage left. Today, guys, we have a special guest, Dr. Chad Levitt. Dr. Levitt, a member of Cliff Co., a good family member here. Welcome to the show.
Thank you so much for having me.
You are the founder and the CMO of OnCare MD. And when I say CMO, most business owners think that's Chief Marketing Officer. But for you, it's Chief Medical Officer.
Correct.
So talk about OnCare MD.
Great. Well, OnCare MD is a cancer patient and family support team advocacy, navigation, and educational practice. Basically, this came out of what most of us oncologists do on a routine basis. In addition to practicing cancer treatment, oncology, we help friends and families all the time, like once or twice a month. And we know it makes a huge difference. So I had some patients, some family members we were helping, and I said, you know what, this is a need that we should try to expand to everybody, even if you don't have a family member who happens to be an experienced oncologist. So it came to a point in my career where I had worn so many hats in the oncology space, director of different departments, private practice, community settings, academics, clinical trials, tumor boards, things that I've run. And I said, you know, I think there's a need here to really help patients piece together every twist and turn that comes with the journey once you have a cancer diagnosis.
And you've been in this space for 20 years, is that correct?
Over 20 years.
Before you get into those details, talk a little about your history so our audience can understand you're not just coming into this as a business owner, you're coming in as the doctor who's been treating people for decades.
Correct. So briefly, my background is that I'm an Atlanta native, multiple generations, and studied undergraduate to get a master's in existential philosophy and creative writing and real liberal arts base. But I have always had the intention of going to medical school to do reconstructive surgery. I just love the anatomy up in the head and neck. My father was a pediatric dentist, so I kind of grew up just really enjoying this anatomy. I was in my head and my career really focused on becoming that type of surgeon, and honestly I was all in, and I was doing a big surgery one day with an older physician who was doing what I thought I wanted to do, and he said to me, he goes, you know, if I could do it all over again, I'd go be a radiation oncologist. He goes, those guys cure the patients, they really incorporate all kinds of technology, biology, and we're just sort of hacking away. And I didn't think about it seriously at the time, but about 2 weeks later, another person who was kind of closer to retirement said almost the same exact thing to me. And I said, you know, I'm doing myself a disservice if I don't at least look into what this is, because radiation oncology is a very small specialty that you don't get a lot of exposure to while you're a medical student. So I went and looked at it, and it was the perfect cross-section of science, you know, sort of humanism and philosophy, dealing with patients in a really serious time in their lives, and technology, which I also really enjoy. And so once I figured out it was a thing, I went head first and took a deep dive and passionately went into radiation oncology, finished my training up in 2004, and practiced in a few different settings over the last couple of decades.
Was it everything that you thought it would be from that input from those doctors?
It was perfect. It was the perfect fit. I get to meet patients at really one of the most troubling, traumatizing points in their lives. Technology and healthcare, at least in that space, is rapidly evolving, and so it was constantly something new, a better way, a safer way, a more effective way to treat patients.
So you've seen things in the past 20 years from, you can't imagine what you did 20 years ago versus today?
Correct, on all fronts. Some for the better, some for the worse.
What would be for the worse?
I would say the landscape of healthcare has changed dramatically, as I think most people probably experience either firsthand or indirectly. The idea of the house call, the idea of just making the patient the center of everything, not only functionally, but emotionally. And the patients themselves notice that everyone in healthcare, doctors especially, are just kind of spread thin. And the idea of being able to take care of a patient with as much time and mindfulness and presence and expertise as we all would like isn't really even that realistic anymore. And so what was distressing, I guess, about the evolution over the last 20, 23 years was just that it got harder and harder as a physician to do what it was that I had set out originally, what most physicians had set out originally to do, which is to care for patients and to kind of, not pure altruism, but feeling gratitude for being able to care for someone in a really serious time of their life.
So was this the impetus for OnCare MD?
Yep, it really was. I had helped patients and families on both sides, both in my clinic as well as outside for so many years, and I just knew there were so many gaps, so many miscommunications, so many opportunities to enhance the care that when you're confined into more of like a corporate or institutional setting, which is what I think the landscape of healthcare has moved towards, it's really difficult to juggle the time and the ability and the expertise to stay on top of it for your patients as well as for yourself, to feel fulfilled about the amount of time and energy that you've put into becoming a specialist like we all seek to be.
So talk about OnCare MD. Like what I'm a patient, and maybe I'm inevitable to get cancer, as you know, at some point with all of us. I'm battling it every day. You know, we're similar aged.
Yeah.
But as a patient, what do they get at OnCare MD? What does it do? What's different other than I have an oncologist, but why would I need OnCare MD?
Absolutely. So when someone encounters a cancer diagnosis, either for their family member, their loved one, their friend, or themselves, we all, as oncologists, know it's traumatizing. It's almost like you went to Afghanistan and were being shot at. It's well studied that you don't hear a lot after they tell you, yes, the biopsy came back and we're sorry to say it's cancer. You just are really traumatized and the world starts swirling around you. It's scary. You don't speak the language of the medical terminology. It feels like you have information overload coming from every direction. Friends and family come out of the woodwork trying to help you, say, you got to go to this person, you got to see this, you got to do what my friend did. You've got the doctor sometimes rushing to kind of say, look, this is what we got to do this, this, and this. But I also have to get to my next patient, and you know, whether I spend 30 minutes, 45 minutes, maybe an hour at best with you and the family to talk about what this means and what your options are, it's a rushed type of thing, and it gets very confusing. And so when someone has a cancer diagnosis, the initial portion of the workup, the medical job, is to make sure that everything that needs to be collected about that tumor, the cell type, the stage, relationship to the other health issues that a patient might have, needs to be gone through with a fine-tooth comb. And all the I's need to be dotted, the T's need to be crossed, because it's like anything. The better you prepare, the better the outcome will actually be. You don't want to be making changes on the fly, especially when it comes to life and death things. So I think about that as the initial step. And today, the science and the technology, which what people might be hearing about with circulating tumor DNA and liquid biopsies and next generation mutational analysis, these are all fancy terms that when you get a cancer diagnosis come into your lap very quickly, because this is an exciting time for the science of taking care of cancer patients. Secondly, though, is the discussion about, well, okay, that's what we have, now what do we have to do about it? And what are the options?
And is this where, just to clarify, your doctor's doing all of this, but is this where you bring OnCare MD in, and do you work hand in glove with their current doctor?
We do. OnCare MD is a full spectrum service platform which just MDs that are working with you and your family as a patient. It's not social workers or nurses.
And these aren't the treating doctors. This is your organization.
This is our practice.
Providing the clarity and support through the process.
Correct. So I had to take a leap of faith, so to speak, and say, you know what? In order for me to cut through all the red tape that puts constraints on my time, my energy, my expertise, I really just wanted to get direct to patients to help them. And the red tape is all the other meetings, all the documentation, all the billing, all the things that doctors and systems and hospitals are tethered to, which consciously or unconsciously, intentionally or not, are also tied to the business of healthcare delivery.
And that's what probably compromises the treatment plan for them to understand. These doctors have all this to do where you're able to provide them this pathway through the process.
Absolutely. The second phase that I was talking about is that you need to know what all the options are, not just what is offered at one hospital or one setting, and they're very different. And sometimes it's stylistic, sometimes there's other forces at play that say, well, we like to do it this way because of X, Y, and Z. That doesn't directly relate to that individual patient, but maybe to the whole system.
So how would people that are in, and we're not wrapping up, it's usually a wrap-up question, but it's truly not a wrap-up question. How would people who are currently getting treatment even know about your service?
You know, that's been our challenge, because as soon as I created OnCare MD and started putting the word out there.
This is about 2 years ago.
This is just about 2 years ago.
And you have amazing patient testimonials, and we'll get to that when we wrap up, but people can also find you, but still 2 years in play and you're still running into how do people get to know about you.
Correct, because out of the gates, the word of mouth need brought patients to us far quicker than I would have imagined. So we've been working out a lot of different aspects to the business of OnCare MD during that time, and only now that we've worked out really all the kinks and we've got a system in place and a cadence that goes with each individual patient that customizes their care and their journey and really seeks to put them back in the driver's seat. A lot of patients, when they get a cancer diagnosis, they feel like they're along for the ride. It's like a lot of things in the healthcare landscape. Healthcare is very reactive to disease and to patients, and the idea of being proactive is attractive, but we haven't as a country really figured out how to deliver it that way. And in fact,
there wouldn't be any money in it for the...
And there's no money in it. The forces that be, money being one of them, time, other people's interests, I guess, from a corporate kind of point of view, are moving in the opposite direction. We've got all these things that are called personalized medicine and precision oncology, where it seeks to make your treatment unique to both you, your makeup, your belief, your culture, your other health issues, as well as the individual aspects about your tumor type and tumor stage and other things that we're learning at the center of everything. However, the forces that allow us to deliver that kind of care are moving in opposite directions.
Just different motivations.
Yeah, we've got fragmentation of care, and who's left in the middle? To be honest, it's doctors and patients.
Patients, that's amazing. And I have to be a little selfish. I know we're wrapping up, but you know, being in the health space myself in terms of taking care of myself for my soon-to-be 54 years and learning so much and traveling the world in this way, how true is it? And I have to ask this in the cancer world, how important is fasting? They always talked about food and cancer and how we just, you know, we have to battle this. And I've had so many people that I know that say if they started a radiation or chemo, they would do a 5 or 7 day fast to help accelerate any of the treatment while trying to maintain the good cells. Is fasting a good proactive method against cancer?
I'm glad you asked that. It's a great question, because a lot of patients come to us usually after they've seen their first oncologist. They've gone to their first oncology visit, because it's not an uncommon question. A patient will say, well, doc, you know, what kind of diet should I be on? And most of the Western doctors in the hospital systems, we don't get a lot of training about it. They'll say, oh, it doesn't really matter. Just make sure you don't lose too much weight. But patients and all of us kind of really know that it does matter. And it matters in a way that's individualized to you. So at OnCare MD, I can and my team can discuss with a patient and their family what we call integrative or complementary medicine, where it is not defined for us, other than what's an appropriate standard of care here in the US, what and how we talk to patients about their options. And integrative medicine, which includes diet and exercise and sleep health and stress management and mind-body medicine and all sorts of things that aren't necessarily reimbursable, so to speak, but are really important to the wellness and the longevity.
Have you seen that influence the treatment? I mean, you're living in this world.
Yes. So we talk with patients about all of their options and help them in a really relaxed setting at the comfort of their own home or wherever they want to be with their own family members, the pros and cons of all of the options that are out there, not just what's offered here or there, because we're not tethered. So we're doctors, and we're not paid by anything related to the treatment or the studies or the referral patterns.
Your motivation is the patients and the patient's care.
The patient is at the center of everything.
Dr. Levitt, it seems like such a bespoke, personalized type of approach that you provide. And I know as we wrap up, I have to ask this question for viewers out there and listeners. It's not so much related to you, an OnCare MD, but you've been an oncologist for over 20 years. Mm-hmm. When us as patients come in for appointments, do doctors even look at the schedule? Like, people wait forever. You know, you joke about the fact that doctors are never coming in and seeing the patients on time. I just have to, for the community out there watching, I have to ask this inside baseball information.
Two big messages. The healthcare landscape is such that it's not a hate the players, it's hate the game.
Sure.
Thing. The landscape is really difficult, and it's like no different than any other corporate or institutional system or company. The biggest message that we seek to empower patients to take advantage of is that they should feel comfortable wanting and ultimately kind of demanding to be an informed consumer of healthcare.
Fair.
And they don't necessarily know how to do that. We give them the tools to do that. Our mission statement is advocacy through education. And then we hold their hands like they're our family member. We have lots of touch points before and after every doctor's visit, every test, every result. We help them organize their thoughts, get the bullet points down, and then we act as liaisons to the treatment team. Ultimately, the treatment teams, a lot of them will be like, why do you have another oncologist helping you? Well, I'm your oncologist. Well, once they realize that we shoulder the burden of tons of the logistics, because we have the time and space to individualize care and navigation. And
you're probably welcomed.
We're welcome. They're like, oh my gosh. These patients came to us so much more informed than any patient we've ever had. They were able to make the most efficient use of our time. And the doctor ultimately is like, so happy. They say, we got right down to the nitty gritty. They wanted to know between this clinical trial or that clinical trial. They didn't have to understand what a cell is and what necessarily chemotherapy is different from radiation. We covered all of the basics and the next level. And to be honest, the tiers that even doctors in hospitals aren't able to touch on right now, because there's so much evolution in the treatment and science that it's hard to know what is going to end up being the most effective thing in the future. So by the time somebody gets into a textbook or a journal, it's usually a couple years old.
Yep.
We're able to stay on the crest of that wave with the patient, and really back to the patient mindset, we're able to help them accomplish what the really easy part, which is after you've done the workup, after you've weighed all the options and done really great informed consent with the patient, now let's go find the best treating doctors who are doing this 10 times a week, not just 10 times a year.
That's valid.
And they can find who do they want to be their treatment team. And often it's the people they have in place, and we just help enhance that, make it more efficient, make the journey more comforting, and make them more confident in their own decisions, and minimize errors, reduce costs, and all those kinds of things that come along with just focusing only on the patient.
Dr. Levitt, time flies when you're having fun.
Right.
And talking about this topic, although it's a very, very challenging topic, and you know, for viewers out there, if you have a loved one or if you're going through things, how do people get in touch with you?
We have a website, we have a phone number, we have...
what is the website?
So the website is www.oncaremd.com. And you can go there, you can fill out our form. We give 20 to 30 minute free consultations to say, is this a good fit? We're not looking to waste anyone's time or energy. And if it's not something we think we can help move the needle on, we're very honest with the patients. Now, some patients still just want someone in their corner that isn't incentivized by anything related to their journey. So sometimes just having us on their shoulder to talk about their choices and to talk about their side effects and to talk about their options makes them more confident in the journey that they're already on, or the path that they're already on.
And I'll tell you, stress, we know, is a big indicator of causing even more of these issues in your health and wellness. So this is decreasing your stress as well. Dr. Levitt, thank you so much for coming on today.
Thank you, Lee.
Ladies and gentlemen, my gosh. Okay, I'm glad I have a new friend here. And I hope that I personally don't need you, but for loved ones and family members of my own, I'm going to definitely refer them in your direction. Thank you, everyone, for joining us today. I hope this show was as insightful for you as it definitely was for me. We hope to see you again next week on another episode of The Roadmap.
Thanks for watching The Roadmap with Lee Heisman.